Hi loves, my name is Nicola Salmon and I'm a fat positive fertility coach. I support fat women who are struggling to get pregnant, to find peace with their bodies, to find their own version of health and to get out of the yo-yo dieting cycle. And today I really want to talk to you about eating disorders and pregnancy. So the question I have is, what advice do you have for someone who is pregnant and still in recovery from an eating disorder? Now, first of all, I just want to say that it's actually quite common for people who are pregnant to be still suffering or recovering from eating disorder. They estimate between 5 to 8% of women who are pregnant either have had or are currently processing or recovering from an eating disorder. So you are not alone. It sometimes can feel that way, that you are completely alone, that nobody knows what you're going through, but I promise you that you are not alone and there are other women out there who are dealing with this. And the first piece of advice that I want to give you is to find support. Tell someone in your health professional team what's going on for you, either your midwife or your doctor or someone who is supporting you through your pregnancy. Tell them about your history of your eating disorder. Tell them about your disordered eating or what's coming up for you right now, because they are going to be able to support you through that and give you the help that you need. You might be on medications for it still, and that's completely okay, but make sure that you're discussing what medications you're taking and how much you're taking with your doctors so that they can support you through what meds are okay to take, what meds aren't okay to take, and how you can really manage that together. If you are pregnant, chances are they're going to want to weigh you as you're going through your pregnancy so they can monitor how things are going with your pregnancy, and that can be really triggering when you're recovering from an eating disorder. So if you tell them that what's going on, they can do that without you knowing. You can turn around on the scales, you can close your eyes, you do not have to know that number, and it will just support you in an extra step from being triggered by that. Once the baby's here, you are also going to need so much support during that postpartum period, because that again can be super triggering because your body's changing. There's so much going on. We're so used to this rhetoric of like bouncing back from babies. So it's really important that you get that support from every area that you can. And if you're not getting enough support from your doctor, from your midwife, from your healthcare professional, seek extra support. Find an eating disorder charity or an eating disorder support service or a mental health support service or a coach or someone who specialises in supporting women through this to get the help that you need. The second piece of advice I have is to really watch out for those triggers. You might know what your triggers are with your eating disorder, but you might not. So just be really aware of what things are bringing up feelings that you don't want to feel in you. So it could be the weighing that we talked about. Some of the pregnancy apps that you get kind of tell you how much you should be putting on in weight, and they can be really triggering too. So just watch out for the information that you're taking in around your pregnancy. And the same goes for like internet forums, pregnancy books. Some of them can be triggering. So just be super careful about the information that you're letting in. Other people's comments can be super triggering because people think it's okay to start commenting on your body and your weight. So have a phrase or something that you say to people when they comment on your body. Just tell them, that's not appropriate for you to comment on my body, thank you, or something along those lines, because the more that you can shut that down straight away, the less you'll be exposed to it. And just be really aware of your thoughts and your behaviours as you go through your pregnancy. Be really kind, be really gentle with yourself, and just start to notice how you're getting on in your mental health. Talk to somebody about these things and put a plan in place for when you experience those triggers, just so that you can really support yourself through that. The final piece of advice I have is to meet yourself where you are. Your body is changing. When you're pregnant, that is the only thing that you can be certain of, that your body is going to change. And with every day, it will change in a different way, and you may not know how that is going to affect you. So just be really gentle with yourself. Meet yourself where you're at. It is really common for triggers, for thoughts, for behaviours to return in pregnancy. And your body is doing an absolutely incredible thing by creating this new life, But it is totally okay to hate your body. It is totally okay to hate not being in control and not having an idea of what's going to happen and how it's going to happen and how it's going to make you feel. That can feel really scary. So just be honest with yourself about how you're feeling, about where you're at, and get support when you need it. And just be aware of that postpartum period too, because we can often be so focused on the pregnancy, we forget that post-pregnancy things don't go back to normal. You know, once you've got a newborn baby, you're sleep deprived, you're going to be reaching out for foods that might be triggering for you. It's really common, it's really normal, but get the support that you need. So I hope that's been helpful. Get support, watch out for those triggers, and meet yourself where you at. If you have any questions, you can catch me on my website, nicolasalmon.co.uk. I'm so happy to answer any questions that you have, and I wish you all the luck in the world onto your pregnancy and beyond. Take care.